fundus
photos and identify those lesions.
Yeah. Thank you, sir.
Thank you.
Dr. Inder Rustagi, please do come.
Dr. Sadhana, I would like to know that since you have been practicing in Jammu for a long time, and how AI has helped you to cross those geographical barriers and overcome, and especially in wet ARMD, what are the challenges you faced while treating those patients?
So, ma'am, in J&K, basically, because of the hilly terrain, it's very difficult for the, like, ophthalmologists are it is such a big state, but ophthalmologists are mainly in, precisely, they are only in 100 kilometers only. So the whole of the other area is like without ophthalmologists. So with these AI tools, with the help of optometrists, and now we are training school teachers also to get photographs. So with their use, we are able to penetrate more into the population.
Thank you. Thank you so much.
Thank you, Dr. Abhishek. With this, we move to the next talk by Dr. Inder Rustagi. Sir will be telling on AI-based smartphone apps in ophthalmology.
Good morning. Well, the latest in smartphones and all that has been explained or very well given the version by Dr. Kim So. But this is basically an overview of what is available for the general ophthalmologist and what basic things or by Indian ophthalmologist we are having in tele-ophthalmology tele-apps. Smartphones have ignited massive change in human interaction across the world and also had an impact on our diagnosis and practice of ophthalmology. These apps provide us a wealth of knowledge and information and essentiality with the tap and scroll of the screen. So that app, when we use, we are examining patients and documenting findings. App is recommended to the patients, and those help in professional education and practice management. So there are numerous apps which are helpful to the patient and the people with low vision also, not only navigate their smartphones, but also their environment and improving their daily lives also. So this is basically the mobile-based technology is again the future of the telemedicine, outreach activities and visual acuity helping. There are so many apps and capable of detecting vision degradation even before they present to the healthcare professionals also. So by this, the patient becomes more engaged and direct interaction, and we can, low cost, we can have their compliance is increased. And these applications are capable of improving disease outcomes as well as diagnosis, and of course, alleviating the vision-threatening problems. So many apps, they have increased in numbers with Android and iPhones. Some apps are available in Android, some are available in iPhones. And around 300 apps are for general use, general healthcare also. So around 75% of the apps are available for free, but some are having cost. Some are, given free trials also, but they later on give the cost on that. So these are apps as per utility and operating systems. Even for amblyopia we have got, even for vision screening we have got. So low vision assistance also we have got. And of course diabetes, ARMDs, they are all innumerable apps. So more than, they have reviewers also, they are designed for non-eye care practitioners also. Eye test app, which is designed for general public, is the largest number of the reviewer rating, and it is the app which is having maximum reviewer is smart optometry app. So they need validation also. 4% apps are claimed by the developers that they have been given by some validation test. And these apps were designed by eye care professionals without developer involvement. 10 apps were endorsed by eye care professionals. But this one app which has been approved by FDA is My Vision Tracker app, is the first app which was developed. So basically, this is how the given smartphone applications in eye care. So many things is there. And another app is Peak Acuity app. which is highly validated app. It is capable of accurate and repeatable acuity measures in either set in elderly population. App is efficient tool for school screening also, and it can be used by non-ophthalmic staff also, and not in Indian population, but in Chinese and Australian population given satisfactory results. It has been developed by ICH in London. Another is Ophthalmology Guide, which is a well-organized and topic-oriented e-book app, which is showing systemic details of every topic and subspecialty. Includes latest ophthalmic instruments also, and it is very convenient for the ophthalmologist also. There are specific guidelines for the use. Another app is iTube app, which is basically global ophthalmic video pool. It collects all the professional videos in ophthalmology and educational surgical videos with free access also. Breaking news are also given that. It saves time and energy when we are searching for the latest thing on the YouTube or Google. Another app is Community Eye Care app, which is free online and offline access to the peer-reviewed articles. It aims to improve standardization and enable easy access to eye care knowledge for all categories, and it is supported by NGOs like Conrad Hilton Foundation, Sightsavers, Orbis, and Seva Foundations. Free hand book app, which is basically for the diagnostic and treatment reference. It is a one-stop shop for multiple needs of ophthalmic practice, and one of the most popular app amongst eye care professionals, with over 500,000 download and 25,000 active users. It includes a near vision chart, Amsler grid test, macular degenerations, and color vision testing also, and coding guides, videos, reference, everything is there into that, and it has been mentioned and endorsed. Smart Optometry Eye Test for Professional app is basically, it is available in many languages for both the phones, Android and iPhones. It is fast, easy, and results are accurate, reliable, and clinically validated. And one of the most downloaded app by healthcare professionals with more than 50 to 60,000 downloads. So various vision screening tests, including color vision, near vision, amblyopia, they're all there in Smart Optometry, this app. Another is My Vision Track app, which is just now told you. It converts Apple smartphone into a medical device itself. It tracks the progression of the vision-damaging disease such as ARMD and diabetic retinopathy. And patients' data are automatically uploaded to the patient's portal. And it is validated as a remote monitoring tool at home to track treatment and detect diseases. So LI is another app which is also approved for monitoring maculopathy, but it is having a cost on it. So many the app are available in market, and especially by Indian ophthalmologists, like toric IOL markers by Dr. Dholaki, also iToric by Dr. Patwardhan. So these are all available and almost without cost. So another is visual intervention kit with analytics for special children, where they give visual exercise and cognitive visual functions, autism, cerebral palsy by Arvinda. And Dignify app is by Arvinda, and but it requires smartphone with operating system, Android also, and Dignify hardware platform. It is best app for the visually impaired without using Braille, and cost is free for basically to help them in daily activities. Another is Ogalcam Medical Records app, which is by Dr. Meher Wade, and again it requires a smartphone, so patients' reports and fundus records, they can be kept on that. Language apps are there by again Dr. Akara, and so in different languages, this app gives you so many things on that. So it has got another apps are 3D8 Plus, iDoctor JD, iGrader. Another is MI RedCam for fundus imaging, and so many things are there. These companies and institutes in India have changed the diagnostics and treatment by teleophthalmology. So most innovative apps for visually handicapped persons like Samsung Goods Wife, Be My Eyes, and LV Free Vision Enhancers, Iris Vision, The Voice. So future and conclusion is concerning professional education apps such as iHandbook and iEmergency Manual apps. They are, by institutions and they are well endorsed. We need to have proper guidelines for the appropriate apps which are to be suggested. And again, just like Dr. Rajiv has said that RSIDI and BSRI have come up for guidelines. So interdisciplinary collaboration in the design, development, and validation as an app is required. So these apps should be low cost and should be able to guide the patients. Ophthalmologists have to be aware of these apps, and so that we can do the best for the patient. Thank you.
Thank you, sir, for the extensive information on all these apps. By the time Prasanna is getting ready, just to add that Dignify app, as you have told, for the low vision aids, because when we were working in Arvind Hospital, Dr. BG Madam, Setti sir and Sahitya, actually it is very, very helpful. With the help of Mindtree, they have done Arvind system, so it's very useful for LVA patients. Similarly, almost all the time-tested investigations for ophthalmology were with the help of apps, it's becoming easier. So let's see in future it will definitely help the eye health professional even more. Thank you, sir. Thank you.
Thank you very much.
So,
are there any regulatory bodies, and how reliable are these apps, and how do we trust these?
I think Dr. Kim
apps?
would.
Dr. Kim, sir.
Are
highlight
there any
on this.
bodies who regulate this kind of?
These software as a medical device, SMD, has to be certified CDCSO. It's a central government body. Now it has been there for the last, I think, 2 years, where they have started certifying these smartware applications as so only those should be used technically. So they certify them.
Because many of the apps are used by patients themselves.
Yeah.
So
Today there are so many in the market, but for the last 2 years, now that certifying body has come in, they go through this process of safety, all that factors are taken into consideration. So any application has to go through that.
Sir, can
If you're
2C
using it as a medical device.
Sir, can
Thank you,
2C
sir.
be any help in the selecting apps?
No, we can't.
Sir,
we can
where to work,
get
sir?
we
Where to
can
work
take
up?
a list of those which are really certified. We can't do the certifying, or we can't.
Recommend-
I don't think we have the wherewith to evaluate these devices. I mean, these software.